Good afternoon, Patrick Rawson. Let's begin the warm-up session. Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system, and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here, nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
What is your career goal after reaching your dream destination?
Right now, I do not have any clear management goals. I am very interested in learning about management and leadership, and would be interested in any committees that I could participate in and learn. I have lots of ideas and would love to be in a brainstorming group, and I am very interested in the management dynamics of the organization. I feel that I need to join leadership groups to learn and meet new people.
What are the qualities that a nurse should possess?
Of course, a nurse should possess a variety of qualities. First of all, she should possess excellent communication skills, which help them not only to gather clinical data but also to maintain an effective relationship with other team members. Secondly, problem-solving and critical thinking skills are essential for nurses to deal with emergencies and difficult situations. Other qualities such as punctuality, dedication, honesty, and competency are also pivotal for nurses.
What are the different roles of a nurse?
A nurse plays different roles in her profession. The primary role of a nurse is a caregiver. Apart from this role, she functions as a mediator, advocate, counselor, educator, and the like. A nurse plays a very crucial role in the healthcare system, connecting various departments in the industry for the welfare of patients.
What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult but also rewarding.
Your preparation time is over. Please start your OET speaking roleplay.
Good morning, my name is Patrick Rawson, and I'm one of the nurses here today. I can see you're feeling uncomfortable. I'm sorry you're going through this. How can I help you?
Hi, thanks. I've been having this really annoying earache for the past day or two, and now my hearing feels a bit blocked. I just wanted to know what I can do about it.
Thank you for sharing that. Before we proceed, how may I address you?
You can call me Mihiraa.
Mihiraa, first, let me say that you've done the right thing by coming in. What I'd like to do is first understand a bit more about what's going on with your ear. Then, I'll explain how we can help you manage this, what you can do at home, and when you might need further medical help. We'll go through this step by step, and I'll make sure you're comfortable throughout. To begin with, you mentioned you're having ear pain and some hearing loss. Could you tell me a little more about the pain?
Sure, nurse. It's mostly a dull ache, but sometimes it feels like a bit of pressure or throbbing. It's not unbearable, but definitely uncomfortable. I'd say it's around a 5 out of 10 most of the time.
Thank you for explaining that. And have you noticed any discharge or fluid coming from your ear? Any fever, or other symptoms like dizziness or ringing in the ear?
No discharge, no ringing either. I did feel a bit warm yesterday, but I don't think I have a fever now.
Alright, that's helpful to know. Now Mihiraa, just so I can get the full picture, could you tell me some relevant medical history of yours?
I had a bit of a cold about a week ago. Nothing major though. And yeah, I've had a few ear infections as a kid, but not for a long time. I haven't been swimming recently either.
Thanks for sharing that with me, Mihiraa. Based on what you've described, it sounds like you might have a mild ear infection, possibly linked to your recent cold. The good news is that many ear infections clear up on their own without needing antibiotics. At home, you can manage the symptoms by taking pain relievers like paracetamol or ibuprofen to ease the discomfort. It's also important to keep the ear dry, so try to avoid getting water in your ear when bathing or showering. And as tempting as it might be, avoid poking or cleaning the inside of your ear, even with cotton buds, as that can make things worse. Getting plenty of rest will also help your body heal.
Okay, that sounds manageable. Is there anything else I can use to help it heal faster?
Yes, there are a few over-the-counter options you might find helpful. You can continue with paracetamol or ibuprofen for pain relief, and if needed, there are some simple ear drops available at pharmacies that can provide extra comfort. However, I'd suggest checking with the pharmacist to make sure they're suitable for your situation, especially since there's no discharge. Do you have any other concerns or questions, Mihiraa?
Would it be possible for you to prescribe me some antibiotics, just to get rid of it faster?
I completely understand wanting to feel better as quickly as possible, Mihiraa. However, as a nurse, it's not within my role to prescribe medication. Also, in most cases like yours, antibiotics aren't necessary because the body is usually very capable of fighting off the infection by itself. We try to monitor it first before considering antibiotics, to avoid using them when they're not needed.
Alright, I see. That makes sense.
You're doing the right thing by coming in early and asking for advice, Mihiraa. Ear infections are very common, and in most cases, they clear up on their own within a few days. Your body's immune system is strong enough to handle this in most situations. However, if you notice that your symptoms are getting worse, if the pain becomes severe, or if you don't see any improvement after about 3 days, I would advise you to book an appointment with your GP. They might need to check for any other issues, like a bacterial infection or a possible perforated eardrum, although that's less common.
Got it. Thanks for explaining everything so clearly.
You're very welcome, Mihiraa. If you have any worries in the meantime, feel free to reach out. Take care of yourself and get plenty of rest.